The crick in your knees, that very first gray hair, that unexplainable insomnia, can't find your keys. Who wrote this? This is my life. Can't find your keys in the morning. Is it cruel signs of aging or more serious than that? And joining us to answer those questions, Dr. Stephanie Bean. Good morning. Thank you very much for being here. Now, we're talking about age and whether aging is natural or something you can prevent.
Aging is natural, but how you age is within your control. So the body goes through a degenerative process as we get older and pile on the years. But through that degeneration, we're at risk for certain diseases like heart disease, diabetes. So can we manage that? Can we have a productive life as we get older? Can we not necessarily have longevity, but what's the quality of life when you reach those golden years?
Let's talk about the crick in the knees, because we were just talking before off camera and how I said I was running upstairs and all I heard was click, 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 click. When do you know it's a serious problem or something that just happens?
Well, I think the important thing is, does that crick and the pain in the knee cause you to slow down? Does it cause you, I can't go to the gym, I can't do the things that I used to do? And of course, when you don't exercise or move, then you're at risk for not being flexible and gaining weight, those sort of things. So you can look at this and determine if it's a cartilage problem. Is it something that needs an x-ray? Is it something that you need vitamins or supplements for? So it's important to check that out so it doesn't progress and doesn't cause you to slow down.
How do you know when those things that we just mentioned, like forgetting stuff and, you know, not being able to like walk up the stairs, you hear the noise in your knee? How do you know when it's just getting older and it's a real problem?
Well, I think when you look at how that's affecting you in terms of, gee, I'm not doing the activity that I used to, or if your wife tells you, you know, I think there's some forgetfulness going on. So it's time to, I think, have a chance to look at that.
You know, you talk a lot about something called age management health care. I didn't know that actually existed. What is age management health care?
Well, age management medicine is actually a specialty that looks at, can we influence the aging process and have a quality of life as we get older? I mean, how do you want to vision yourself when you're 60 or 70 years old? And we can see that a lot of times movement is affected, sexual health is affected as well. And should we accept that, or should we consider it as a disease and influence that and make that better? Sometimes there are very simple solutions to that.
And so what do you suggest for people when they're thinking, oh, it's just a part of getting old? I have this fight with my mom all the time. She's in her 60s, and she's like, oh, it's just old age. You'll get there one day.
Well, a lot of times that's a state of mind. But what is your attitude about being? You're as young as you feel.
That's true.
And it's important to maintain that positive outlook, but I think also to look at things like the crick in the knee. There's also bone thinning and osteoporosis risk, as well as sexual health and memory and those sort of things. So, yeah.
Dr. Bean, thank you very much. I feel a little bit better about myself right now. Not as old as I used to feel before we started this interview. Thanks so much for being here. We appreciate it. We'll be back with a final check on your weather forecast when we come back.